press conference to respond to the lapse in SNAP benefits. Here in Schenectady County, there are over 21,000 of our neighbors who are not able to access healthy and nutritious food today. 22% of all Schenectady County children, 22% of all Schenectady County children are not able to access their SNAP benefits today. And so I am so thankful for you all gathered here as allies and to be in solidarity with one another and to speak out about the importance of our emergency food system and our responsibility to care for all of our neighbors, especially as we head into the holidays. My name is Reverend Dustin Longmire. I'm the pastor at Messiah Lutheran Church in Rotterdam, the interim board chair at the Rotterdam Community Center, and the co-chair of the Schenectady County Food Council Advocacy and Empowerment Working Group. We have a wide variety of speakers today who are going to speak to how important it is that we restart SNAP funding as soon as possible and, in the long run, address a wide variety of gaps in our emergency food system that were issues before these SNAP benefits lapsed. Our first speaker today is Justin Cook, the co-founder of the Fresh Table Community Pantry, who are hosting us today. Justin.
Thank you. Good morning, everyone, and I want to begin by first thanking Reverend Dustin Longmire, the Schenectady County Food Council, community advocates, and the food providers here today for rising to the challenge to helping our neighbors through this crisis. I've had the opportunity to have been involved in the emergency food support system for a couple years now, and I'm joined here by my colleague and co-founder of the Fresh Table Community Pantry, Kim Talbot. When comparing, actually a recent email that actually went out by the Capital Region Food Pantries, when comparing grocery prices in New York State, from October 2019 to today, there has been an average increase of 38%. This substantial rise has stretched household budgets to their limits. And for our neighbors who rely on SNAP, many have had to find new ways to make their benefits go further. During this time, more and more families have turned to food pantries to supplement their nutrition. At the same time, hardworking families and seniors are finding it harder to bridge the gap from their paycheck to their plate, also turning to food pantries just to make ends meet. This need has become increasingly prevalent in the suburban and rural communities, where food assistance and food pantries may not be as readily available. Since we started in 2022, here at the Fresh Table Community Pantry, we've seen a 150% increase in requests for food support, with nearly 2/3 of our neighbors living in suburban communities around Scotia Glenville. About 20% of our Fresh Table neighbors rely on SNAP benefits to provide roughly 12 meals each month. They come to us for another 3 meals. We serve as a bridge, helping families stretch their benefits and maintain access to fresh and healthy foods. That is the reality on most days. But we're not living right now in most days. The loss of November SNAP benefits compounds an already difficult situation, creating a food security crisis right here in our neighborhoods. Nearly 12,000 SNAP households in Schenectady County now face uncertainty about where their next meal will come from. And pantries across the county are already seeing a significant rise in neighbors seeking assistance. Pair this with the need with a furloughed federal workforce, the loss of SNAP, we are facing a perfect storm. The holiday season is always a busy season for pantries, but this year we will be tested even more. We will do our best to respond to the crisis with compassion and understanding, but let me be clear. The charitable food system alone cannot replace the support provided by SNAP. Amen. If this crisis continues, food pantries will run low on supplies. SNAP benefits must be restored as soon as possible. Not next month, not next week, now. In the meantime, ordinary neighbors like you can make an extraordinary difference. We can set aside politics and act with open hearts. We can remind our community that neighbors need neighbors, that we need each other, and that my neighbor's struggle is my struggle. So here's how you can help. Double your support. Give your time and your donations to both the Regional Food Bank of Northeastern New York and your local pantry. Provide direct financial support to your local pantry. It is the most flexible and cost-efficient way to keep our shelves stocked. If you want to donate food, connect with community organizations like Schenectady Shares. They can accept your donation and distribute it where it's needed most. But perhaps more impactful, you can check on your neighbors and family members who may receive SNAP benefits. Simply invite them over for a meal or bring them a care box. Here at the Fresh Table, we always believe that there is enough food to share. Let's work together to make that possible.
Thank you so much, Justin. And I would like to next call forward Krista Hesdorfer from Hunger Solutions New York. Krista.
Thank you. I am honored to be here on behalf of Hunger Solutions New York, a statewide organization dedicated to alleviating hunger by maximizing SNAP, WIC, school meals, and other federal nutrition programs. I am...
Did we cut out?
Can you hear me? Can you hear me now?
Yes.
Okay. I am deeply grateful for the many ways our communities have stepped up in the face of this crisis. Neighbors from all walks of life asking without hesitation, how can I help? From neighbors donating to food pantries, to advocates raising the alarm, to our Attorney General suing USDA, New Yorkers have risen to the moment. But at the same time, as I stand in awe of our communities, I am furious that those efforts were needed in the first place. We're standing here because of shameful inaction and cruelty from the United States Department of Agriculture.
That's right.
USDA has been sitting on more than $5 billion in contingency funds intended to sustain SNAP in a shutdown or emergency. This entire time, USDA has had both the resources and authority to provide November benefits without delay. They chose to disrupt food assistance for 42 million Americans, including nearly 3 million New Yorkers. These are our kids, seniors, people with disabilities, working families, and others who are just trying to put food on the table. Friday afternoon, when 2 federal judges ordered USDA to issue November benefits, we all breathed a sigh of relief, but only for a moment. We know the proceedings are ongoing, and even in the best case scenario, it will take time to get benefits out the door, time that families do not have. We urge USDA to minimize the damage by immediately releasing funds and guidance to states so they can get food aid to families as quickly as possible. But unfortunately, this is just one of many recent attacks on SNAP. The federal budget bill passed this summer includes the largest cut to SNAP in American history, $187 billion over the next 10 years. The bill jeopardizes SNAP access for hundreds of thousands of New Yorkers, shifts enormous costs to state and county budgets, and reduces benefit amounts that were already inadequate to cover rising food costs. In the face of all of these federal cuts, we turn to our state leaders for help. We urge Governor Hochul and our legislative leaders to protect and strengthen SNAP and other food security programs in the upcoming state budget. And if there are any further delays or reduction in SNAP benefits during the shutdown, we ask New York to step in with state funding to fill the gap. Over the last several years, New York has made historic investments in universal school meals, SNAP navigators, and emergency food programs. Now we must build on that strong foundation, rising to the moment just like our friends and neighbors have over the last few weeks. Together we can and must ensure all New Yorkers have the food they need. Thank you.
Thank you so much, Krista. And I want to call forward next Helen Wose, one of our amazing Schenectady County community advocates.
How you doing? I'm Helen Wose. I'm an advocate, and I work full-time for almost 20 years as a state worker and suffer from food insecurity. Unfortunately, for me, I don't qualify for SNAP. So I depend on other resources like my community and my local community center, RCC, to offset the cost of food. There were many times I had to choose between dinner that night or gas in the car to go to work the next day. Let me tell you folks, going to work hungry and working through the day is no joke. I shouldn't be here fighting for something that is already ours. Eating is not a privilege, it's a right. If you cut and take away SNAP, not only do you leave a lasting effect on adults, children, and seniors' health because of lack of nutrition intake, but I don't have a fighting chance. Halloween may be over, but the trick for treats is not. We shouldn't be treated like peasants begging for what we've already paid for.
That's right.
Let me leave you with a quote. If America wants to remain a first-class nation, then she can no longer treat us like second-class citizens. Martin Luther King. Thank you.
Thank you so much, Helen. I'd now like to call forward for the perspective of our farmers. Corinne Hansch, Loving Mama Farm.
Thank you. I'm an organic farmer and the owner of Lovin' Mama Farm in Amsterdam, New York. We grow about 50,000 pounds of organic food every year on 10 acres, and we do it year-round. No small feat in our climate. We employ 6 year-round staff and 6 seasonal workers, and we pay living wages of $22 to $30 an hour. We use real organic methods, building soil health, protecting pollinators, and stewarding our land using strict ecological principles. Soil is the foundation of everything we do. Our soil organic matter is over 12%, a level that's almost unheard of in conventional agriculture. What that means in plain language is that our soil pulls carbon out of the atmosphere and stores it safely in the ground. Our soil holds nutrients without synthetic fertilizers, absorbs heavy rainfall without flooding, and stores water during drought. This is what climate resilient agriculture looks like. Our farm is a thriving ecosystem. We spray nothing but water. We plant to support pollinators and beneficial insects because they are our partners in growing food. In other words, our farm offers real ecosystem services to the community. We sell our produce at 5 farmers markets across the capital region, including markets located in food deserts like the Schenectady Green Market. We see firsthand how much our community relies on access to fresh, nutrient-dense seasonal produce at these farmers markets. About 10% of our customers use EBT to buy organic vegetables from us. Yesterday, I had several teary conversations with EBT customers who did not know when they could afford to return to the market. They weren't sure when they'd be able to buy fresh vegetables again. We have a solution, one that addresses public health and climate resilience and environmental health at the same time. When at-risk communities have even small grocery subsidies, we see major improvements in chronic illnesses like type 2 diabetes. Imagine the impact if we invested in programs that connect vulnerable families directly with organic farms, healthy food for communities, and support for farms that are improving soil, climate resilience, and biodiversity. Vegetable farmers receive less than 5% of USDA subsidies. Organic farms see even less. We're told we don't have any resource concerns. Programs like SNAP and Double Up Food Bucks are some of the only forms of public support and funding we receive. These programs feed families and sustain local farms. We farm because we want to feed people. We work long days because we believe everyone deserves nourishing food and a healthy environment. Restoring SNAP benefits is essential for community health and farm viability. We all need to eat, and we all deserve a food system that cares for people and the planet. Thank you.
Thank you so much, Corinne. I'd like to next call forward County Legislator Michelle Austerlitz, who's going to give us an update on how the county is responding to this crisis.
Thank you, Dustin. I'm Michelle Austerlitz. I'm a Schenectady County Legislator and Chair of our Health, Housing, and Human Services Committee. As we have faced many crises in the past, we're going to try and do it together, and this is neighbors helping neighbors We're rolling out soon an initiative to continue Schenectady Share's food drive along with distribution to our food pantries and food providers. What that means is we'd had an ongoing food drive because we were honoring Schenectady Shares, a network of volunteers, at our holiday parade. Well, we're going to continue that indefinitely so that folks who want to help can look on our website and see how to and where to donate food, non-perishable, and hygiene items, as well as funds, and also to volunteer in this massive effort. We will also have on our website a dedicated page that has up-to-date resources to avoid as much as possible folks going to food pantries and providers that don't have food on their shelves. We will be working with local food providers, hopefully including farms and our agricultural community, and using hopefully some donated funds that come from the public and other foundations, as well as public funds. So thank you very much, and I just want to reiterate what you've seen here today. The strength of our community is there. We will face it. It is unnecessary. It is cruel that we are having to face this, but working together, neighbors helping neighbors, we're going to try our hardest. Thanks.
Thank you so much, Michelle, and to everyone from Schenectady County. I'd like to next call forward Darlene Geloso, one of our amazing community advocates.
Thank you. I hope to get through everything because everything is so important. My name is Darlene Geloso. I will be 67 years old on November 5th. I live on Social Security, $13.50 a month. My son Salvatore, who is autistic and has seizure, gets about $9.50 from SSI. We're struggling to get by. In January, my cost of living will be increased $39 a month. But with the change proposes, it may just not be enough to longer qualify for Medicare, which helps covers my health insurance. My son has seizures. His meds are over $2,500 a month. Most families are just one paycheck away from homelessness. It takes one accident, injury, illness, or loss of income. I should know, 2020 I fell work and injured and broke my fingers. I still have loss of use. I ended up using food banks, Schenectady street soldiers, and stood in lines in freezing and the heat. I ended up using the food I'm sorry guys, but with my injury I could no longer physically access the program. In my time I saw the lines increasing. I finally did get my Social Security disability, and not since I hit retirement. I'm sorry. I was only on SNAP when my kids were small. Having to go back into the system, I never realized how bad it had gotten. The process is long and hard. You fill out applications, paperwork, and obtain so much information. Sit in the office and hope you will receive something, and not as much as people think. The minimum is $23. If you do get an hourly raise, it could put you over the limits. One step forward, two steps back. The system is meant to fail. There are so many myths. Most SNAP participants work if they can work. $1 returns, $1.54, ending up nationally. $1 billion can add $1.5 billion to the GDP and create 13,500 jobs. Undocumented immigrants are ineligible. The program is limited to U.S. citizens and certain lawful immigrants. Over the past 15 years, SNAP fraud has fallen from 4% to 1%. Why are the facts important? Because as an advocate for changes and improvement for people, I get people who are angry about people who are in need getting help. Also showing that people who can make changes do not understand the program that works, but needs improvement. Members of Congress get $79 a day for meals. SNAP recipients receive $6.31 a day. FDR, who brought us out of the Depression, had a second Bill of Rights. Every American has the right to a job, an adequate wage and a decent living, a decent home, medical care, economic protection during sickness, accident, or old age or unemployment, and a good education. All these things go together. Thank God for the food bank, churches, and community groups. Food pantries that try to help people have good food to eat, but the numbers are rising rapidly and they no longer able to sustain the assistance provided. Some have even ran out of food. The lines are long and getting longer. In 1960, CEOs earned 20 to 21 times the typical worker. 2025, U.S. firms earn 281 to 290 times the average worker. Some companies, the gap exceeds 900 to 1. Why are they cutting safety net programs, leaving children, elderly, and military families, working families, and people in poverty desperate? People who die from the cuts to Medicare, Medicaid, and SNAP, to pay for tax breaks to go to the wealthy. We're asking legislators to restore these programs because housing, food, medical, and good-paying jobs are all connected. We cannot give to the wealthy in this country more tax breaks. They must pay their fair share. I do not care which party you belong to. Time to bring us back to the Constitution of the United States. Bring back the checks and balances, independent inspector general, ethics to the three branches of government, and stop the insanity we live in one every day. And I want to read you one last thing. If a free society cannot help the many who are poor, it cannot save the few who are rich. This speaks to the government responsibility to assist the disadvantaged as a priority for the whole society's well-being, as President John F. Kennedy spoke at his inaugural address. There's enough for everybody in this country. Thank you.
Thank you so much, Darlene. Thank you. Just a couple more speakers. Our next speaker is a good friend of our community, State Senator Pat Fahey. I'm so thankful for you joining us today.
Thank you. Thank you. It's actually a privilege to stand with all of you. Thank you, Reverend. Thank you to all the clergy, all the legislators, all the advocates, and more for standing to call this out. I actually appreciated the invite and rearranged things to be here because we must call this out. It is so unprecedented. I tell young people all the time there is nothing normal here. First, the longest shutdown, I think longest, now I think it's the longest, maybe second longest. And the fact that we are using hunger of children, of families, of seniors, of some military families as a negotiating tactic? Hunger? Really? This is what this has come to. And why? What is the real reason for the shutdown? It is because of the health coverage, the Obamacare health benefits that the Democrats are trying to push back on and get those benefits restored, because most people, as of Saturday, as of November 1st, those on the affordable health care plans have seen their premiums, their monthly premiums, near double, from 50% to 100%. So in an effort to try to manage those and keep people insured, they are at an impasse. Congress is at an impasse. And now, as was told so effectively by so many of the speakers, the money is sitting there. $5 billion is sitting there. That can be released. 2 federal courts have ruled. The courts have ruled. We used to have 3 operating branches of government. Not sure what's happening anymore. The courts have already said, release the funds. This is doable. Hunger, seniors, children, families should not be pawns in this political impasse to try to get health benefits, let alone ultimately the big beautiful bill was about giving tax cuts to the wealthy, as our amazing advocate so articulately put. So Justin Cook mentioned compassion. This is a time for compassion. Unfortunately, all we are seeing is cruelty. I never use, it's just not a term I used. It wasn't in my lexicon, cruelty. Now I feel like I'm using it every day. This is cruel. There's no other way to put it, because food is essential. Good food is fundamental. Good food is good medicine. So food, think of what's going to happen to our healthcare crisis already. It's one thing not to restore healthcare. It's another thing to now make food, to make people suffer in this way. It's just going beyond the pale. I'm in touch all the time with our regional food bank, Tom Nardacci. We served on many boards together. It's amazing what we have done in the capital region. He is in regular touch to let us know $4 million a month just here into Schenectady County. 4 million, 21,000 families are not getting that SNAP benefit. And as we just heard, it's not a lot. It had been increased under COVID when we saw the numbers and the need go off the charts. We had hoped to see that increase. Had President Trump not been elected, we had hoped to see that increase. We were fighting to maintain that. The state, I'm incredibly proud of work when I was in the Assembly and now in the Senate. We have stepped up, increased by tens of millions of dollars every year during COVID. We have not taken that away since COVID. We've actually increased it. Kudos to the governor for adding even more. We've released, I think it's 60 million, but we can't do the individual payments. By federal law, we cannot step in and replenish the actual SNAP benefit payments. We can only work with our pantries and our food banks to try to restore. But the bottom line is we will keep stepping up. We will keep doing more at the state level, but this is a federal responsibility. And as we also heard, our food banks our pantries can only do so much. Compassion is essential. Cruelty is not.
Amen.
And in the meantime, we will keep advocating. Let's not use hunger as a negotiating tactic. This is beyond the pale. In the meantime, I'm in touch with all colleagues, and we will keep trying to do more. But the most important thing is what is being done today, and that is calling this out. This is not necessary. Food hunger should not be a negotiating tool. Thank you very much. Such an honor to stand with each of you.
Thank you so much, Senator Fahey. We have 3 more speakers today. Our next is Natasha Pernica from Food Pantries for the Capital District, who has been championing this issue for quite a while. Yeah. Oh, right. Oh, my gosh. I'm losing it.
Hi, everyone. Hi, everyone. I'm Natasha Pernica, Food Pantries for the Capital District. We're a coalition of food pantries and work with pantries here in Schenectady as well. Everything everybody has said is already the same. I'm going to keep this short. Red, blue, purple. We are human first.
Amen.
Food is not a luxury. I have been doing human service nonprofit work for 25 years. We have never experienced a single crisis that impacts 42 million Americans who are relying on SNAP to buy groceries at the store. Today, this week, this month, 42 million Americans are suffering not only incredible emotional stress and strain, but physical nourishment is being taken away from them today. This is a historic moment. This is completely unacceptable, and we will continue to be in crisis at the food pantry and community level until those SNAP recipients have the dollars on their EBT cards and can go to the grocery store and purchase food. Because food is a human right. Without food, there is no survival. What is happening is completely unacceptable. If you are a person in need and you need to find a food pantry or community meal program, or if you're a person who wants to help with cash donations or food donations to your local food pantry that serve the neighborhood, go to thefoodpantries.org, click Find Food Now. It's a statewide resource for food pantries and community meal programs. Let's get this done. Let's be here for our community. Thank you.
Thank you so much, Natasha. 2 final speakers. Our next is Don Wheeler from the Sycamore Collaborative. Let's hear it for Don.
Good morning, everyone. I'm going to probably say some things you've already heard, but from a slightly different perspective. For over 20 years, I have been a volunteer at Sycamore Collaborative Food Pantry. It's the largest in Schenectady County, and I also serve as vice chair of the board of directors. For many of the years that I served, I welcomed our guests and helped them register for benefits at the food pantry, as well as recording their visits. In that time, I've had countless discussions and conversations with folks about their use of food stamps. A question we ask is, do you receive food stamps Most of the times the answer is yes, and then people will often offer the amount that they receive, which to me is always kind of shocking. And I remember that one woman told me she got $28 a month, and I thought in my head, what can you buy in the grocery store for $28 a month that's going to benefit you? I know the amounts vary, but generally they don't meet the needs of the family. In the long time that I've been volunteering in that job, the requests for food has varied. Early on in the pantry, if we've served 100 families a day in the 3.5 hours that were open, that was a lot. Last Wednesday when I worked, we served 177 families. All of them were fearful and worried. Many were there because they were anticipating not getting food stamps in the next month, and many people were there for the first time. Last year, our pantry served the equivalent in groceries of just under 1 million meals. Every month since then, in this fiscal year, has been seen an increase in the amount over the year before. We're nearing the limit of our capacity to provide. It has become clear to me that even in the country's good intentions of providing food assistance, what has been given is generally inadequate. While we may feel pride in the numbers of our fellow citizens that we help, we're deluding ourselves. The problem of insecurity is not being solved. It's a myth. Expecting the local charities and pantries will fill the gap is a strain on these groups that cannot bear long term. In both SNAP benefits and charity efforts, needs exceed what is currently being done to alleviate the problem. Ignoring the health and welfare of children and the elderly in particular, and the food insecurity of the population in general, is cruel, inhumane, discriminatory, and abusive. SNAP benefits must be increased and reinstated now. Thank you.
Thank you so much, Don. And our final speaker is Christy Milligan from the Regional Food Bank. Thank you for being here, Christy.
Thanks, Dustin. Hi, good morning. I have a lot of the same things to say, so I'll be quick. But my name is Christy Milligan. I'm part of the development team at the Regional Food Bank. And as you can imagine, I don't like microphones. As you can imagine, this is one of the toughest times we've faced at the food bank. But of course it pales in comparison to what millions of Americans are facing right now as they're enduring their SNAP benefits lapsing as of November 1st due to the federal government shutdown. While the federal government works on a contingency plan to restore those benefits, it could take weeks for that relief to reach our families. And so at the Regional Food Bank, our service area covers 23 counties, starting down in Rockland County down in the south, all the way up to Clinton and Franklin counties up near the Canadian border. And SNAP covers, in just our service area alone, SNAP allows neighbors in need to access 36 million pounds of food every single month. And so I know we're throwing around a lot of really huge numbers, but to put that into perspective for you, the Regional Food Bank just last year in 2024 distributed 54 million pounds of food across the whole entire year. So it's clear that we cannot cover what's missing due to SNAP benefits being cut. So the charitable food system was never designed to sustain this level of service. And so we, of course, really need our local, county, state, and federal partners to act swiftly with emergency funding. And this is, as everyone else has been saying, this is the time we really, really need our community's support, now more than ever. It can feel so overwhelming and make us feel like we're hopeless and we can't do anything when we think about the fact that SNAP is covering $59 million to our neighbors in need across our 23 counties. But that's exactly the time that we have to remember that we can control what we can control. And this is the time that we need to stand with our neighbors all together. We all need to band together. It's the time for us to volunteer, to donate, and to support to our local food pantries and the Regional Food Bank. So thank you so much for your support and for being here today.
Thank you so much, Christy. Look, this is a unnecessary crisis. But can we use this moment of crisis to remind us that our emergency food systems were already inadequate before SNAP benefits lapsed.
Exactly.
Let's use this moment to band together to serve and work and donate to our local emergency food pantries, our regional food bank, all of our regional groups. But also let's work together to advocate and to organize and to make sure that every single one of our neighbors has access to food as a human right. I'm speaking right now as a faith leader. We have a number of faith leaders behind us. One central teaching of our Christian tradition, but it's there in all of our faith communities, all of our faith traditions, is that one line in the Lord's Prayer, give us this day our daily bread. That's there not to just wish for bread to fall from the sky. It's a reminder that we have everything we need. We already have everything we need to make sure all of our neighbors have enough access to food, except for the will to do it. Let's get this done. Let's use this moment of crisis to work even harder to make sure all of our neighbors have access to food as a human right. Thank you for being here today. Yes, questions. What do we got for questions? Go ahead.
I would just like to hear from Darlene, actually, who I know who spoke about your experience with dealing with this stuff. But just talk about, I'd like to know more in depth about some of the hurdles that you've had to deal with and the concerns that you have, knowing that SNAP, particularly, a lot of these government-assisted programs are at risk of going down.
Do you want to speak on Mike?
Yeah. Well, like they said, it's not just food. It's housing. It's sorry about that. It's not just food. It's housing. It's medical. The stress that people are under is making them sick. There's more than enough in this country, but they don't want to give up things so people can live a life. Why I read that? FDR got us out of the Depression. Those things are gone. Our government is in chaos. Those are the things we need to fix and need to realize we are humans. The least of us, if you take care of them, the best of them get it too. And I think there's just too much discrepancy and it's getting worse and worse.
Thank you so much, Darlene. Do we have any other questions from our press?
We spoke all last week, Dustin. I think you said in one day you got 30 families reaching out looking for an appointment. I'm wondering what that has looked like, these numbers have looked like since the benefits have lapsed on November 1st. So I guess what's this weekend like for you guys?
Yeah, I have not checked in with our food pantry this morning, but I can say that over the weekend we were mobilizing volunteers to cover the phones because our staff just would have done nothing but cover the phones for food pantry appointments if we didn't have volunteers covering it. So it is growing more and more and more. I heard one report from another local pastor who told me that someone broke into the church looking for food and struggling with what to do about that. So it is becoming a crisis for so many of us, locally and across the country. Any other questions? Well, we thank everyone for gathering with us today, and we thank everyone for their efforts, for supporting our local pantries, for advocating on behalf of food being a human right for all of us, and for joining us today. Thank you all so much. Thank you, everybody.